Success of exodontia depends upon use of dental instruments. Here we will learn correct way of using dental instruments as well as some mistakes which frustrate us and lead to traumatic extraction procedures. First is straight elevator. The correct way of using it is to take gentle but firm grip on handle with thumb and last three fingers, keeping index finger close to the tip. Place it straight interdentally between two teeth with its deep groove facing the tooth to be removed. Don't hold it heavily with handle and in palm and no support of index finger near tip. This will induce unnecessary force which will traumatize tissues. Don't place straight elevator at an angle interdentally as can't luxate the tooth this way. This is how to hold and move periosteal elevator to reflect soft tissue surrounding a tooth. After reflecting gingival papilla, keep sharp tip convexity towards tooth. Elevator parallel to the long axis of the tooth and move it horizontally with finger rest on adjacent teeth. Don't move it vertically to avoid laceration of gingiva. Now, let us see how to use curved surgical scissors for cutting soft tissues or suture threads. Hold it with thumb and surgeon's finger, that is ring finger. Keep index finger on hinge close to the beaks and beaks convexity side. Curvature convexity of beaks should face tissue side and always take support on adjacent teeth. Never use it with wrong fingers or without good support or curvature concavity of beaks facing the tissue side. Incorrect use of scissors will cut soft tissues or suture threads in completely improper way. The next instruments are needle holder and artery forceps. Needle holder can be held in two ways. First is SMS surgical scissors. The second method is to hold it in palm with last three fingers and thumb, keeping index finger on hinge close to the beaks. Suture needle is held at its junction of posterior one third and anterior two third with needle holder beak's tip, that is at right angle. Curvature convexity of needle will remain downward for mandible and upward for maxilla soft tissues. Always choose needle holder which suits the size of the suture needle. Too big needle holder for a small needle will flatten it, making it difficult to pass from the soft tissues. Never hold the needle holder with wrong fingers or without support of index finger on hinge to avoid damage to suture needle and to prevent laceration of soft tissue while suturing. Correct holding technique of artery forceps and mistakes related to it are same as those for needle holder or surgical scissors. Now let us observe correct use of various tooth extraction forceps and common mistakes we do while using them for tooth extractions. There are specifically designed extraction forceps for each tooth. We need to follow basic mechanical principle of these designs. Always choose the correct forceps for particular tooth extraction. Hold all extraction forceps firm in palm with thumb and fingers close to the end of the handle. This grip will give benefit of longer effort arm, reducing our input to remove a tooth. Don't keep any finger in between the handles. The beaks of forceps should remain parallel to the long axis of the tooth being extracted. Place the big tips on deepest possible sound mid-buccal, mid-palatal or mid-lingual part of the crown and hold the tooth firm. Palm should remain below handles facing upward for extraction of maxilla teeth, and for mandible teeth extraction, palm should be on handles of extraction forceps facing it down. With correct grip of forceps, right placement on tooth and supporting the alveolus, the tooth should come out without damaging adjacent soft or hard tissues. Correct diagnosis, good anesthesia, and correct use of dental instruments make base of successful exodoncia.